Today, we're going to patiently unravel a very common yet highly bothersome condition that literally almost all of us have encountered at some point. I'm talking about conjunctivitis, or as we popularly call it, the red eye. We'll be acting like clinical detectives today, transforming what could be complex medical jargon into a really clear visual journey. Let's dive straight in. So, have you ever wondered why, especially during those hot, dry summer months or the super humid monsoon season, a perfectly healthy eye can just suddenly become inflamed, deeply uncomfortable, and sometimes even completely matted shut when you wake up? Well, it's actually a fascinating biological response to a variety of invisible invaders. By looking closely at this, we can learn exactly how our body reacts to protect one of our absolute most delicate organs.
To get to the bottom of this, we've got a solid agenda. We'll start by understanding the basics of conjunctivitis, then investigate the bacterial culprits, move on to viral and chlamydial infections, explore allergic reactions, and finally wrap up with the proper treatment and management protocol. Section 1. Understanding conjunctivitis, the basics of the disease. Let's quickly establish the baseline pathology here. So what exactly is happening when your eye turns red and angry? Conjunctivitis is, quite simply, the inflammation of the conjunctiva. Now, the conjunctiva is that extremely thin, translucent mucous membrane lining the inside of your eyelids and covering the white part of your eye. When it gets inflamed, it triggers two main responses. First, we have the vascular response. This is vascular congestion, where the tiny blood vessels dilate, making the eye look noticeably red and bloodshot. Second, there's a cellular response. This leads to exudation, or what we usually call discharge. These two fundamental signs are basically your body's way of telling you that an active battle is raging on the surface of your eye. And kindly note, this condition is highly contagious. It's so important to understand how it travels. These exogenous infections spread incredibly easily through direct contact. Think about contaminated fingers touching your face or sharing common items like towels and handkerchiefs. In many developing countries, vector transmission, like flies carrying the infection from person to person, is also a major culprit. This is especially true when hygiene is a challenge during those hot, humid monsoon epidemics.
Section 2. The bacterial culprits. Let's look at the most common offenders we see in our clinics. The primary causative organisms here cover quite a range of bacteria. Staphylococcus aureus is by far the most common cause of bacterial conjunctivitis. Then we have the Coqueque's bacillus, officially known as Haemophilus influenza, which classically causes widespread epidemics of red eye, particularly in semi-tropical regions. And of course, we must also be deeply aware of highly dangerous, virulent organisms like Neisseria gonorrhea, which require immediate, urgent clinical attention. Now, this brilliantly illustrates acute mucopurulent conjunctivitis. Patients with this suffer from intensely red eyes and a really persistent foreign body sensation. It literally feels like you've got sand in your eye, doesn't it? And notice the sticky, yellowish mucopurulent discharge. That discharge forms crusts that literally glue the eyelashes together overnight, making it incredibly difficult for the poor patient to even open their eyes in the morning. Let's see how this builds up in certain, more virulent infections. In cases caused by organisms like Streptococcus pyogenes, we might observe something called pseudomembranous conjunctivitis. Notice that yellowish-white membrane forming on the palpebral conjunctiva. That's the inner lining of the eyelid. What's really interesting here is that a doctor can actually peel this pseudomembrane off quite easily without causing any bleeding, which is how we clinically tell it apart from a true membrane. Moving on to Section 3, viral and chlamydial infections. These are our intracellular invaders, and they present a slightly different yet equally troubling clinical picture. So, unlike that thick, sticky pus of bacterial infections we just talked about, a viral infection typically presents with a clear, watery discharge. These are mostly caused by adenoviruses. Viral conjunctivitis brings about a boggy swelling of the conjunctival mucosa. The eye feels super uncomfortable, sure, but you won't see those heavy yellow crusts on the eyelashes. It's more of a persistent, watery weeping. Now notice the really dramatic presentation here. Look at that bright red bleeding just under the conjunctiva. This subconjunctival hemorrhage is the absolute hallmark of acute hemorrhagic conjunctivitis. It's a wildly contagious condition caused by enterovirus type 70. Outbreaks of this specific virus can spread very rapidly through direct hand-to-eye contact in our local communities. Under the same category, we absolutely must mention chlamydia. Now, chlamydia is a fascinating organism that lies somewhere midway between bacteria and viruses. Certain serotypes of Chlamydia trachomatis cause what is commonly known as swimming pool conjunctivitis. As the name suggests, the infection is often transmitted to the eyes through contaminated water in swimming pools. This leads to the formation of tiny, translucent swellings called follicles inside the eyelids. They look almost exactly like boiled sago grains. Section 4. The allergic reactions, the body's overreaction.
Our next group of suspects doesn't actually involve an external infectious germ at all. This brings us to a really fascinating physiological fact. Our delicate conjunctiva is literally 10 times more sensitive to allergens than our normal skin. Think about that for a second. The slightest bit of dust, pollen, or animal dander that wouldn't bother the skin on your hand even a little bit can cause a massive inflammatory cascade the very second it touches the surface of your eye. It's truly an overreaction of the body's defenses.
Simple allergic conjunctivitis is triggered by exactly those everyday environmental elements, pollens, grass, or animal dandruff. It's very frequently seen alongside hay fever or allergic rhinitis. But here is the major distinguishing factor you see. Allergic conjunctivitis is uniquely characterized not by a gritty feeling or severe pain, but by an intense, maddening itching. The patient simply cannot resist rubbing their eyes, which, of course, only makes the inflammation worse.
Section 5. Treatment and management, the clinical protocol. Okay, so now that we've expertly identified all the major clinical suspects, how do we actually manage and treat them?
This master comparison table right here is basically the heart of our diagnostic process. Look at how neatly it divides up the culprits. If the discharge is thick and mucopurulent, accompanied by a gritty feeling, well, it's highly likely to be bacterial. On the other hand, if the discharge is watery, with a general sense of discomfort and enlarged lymph nodes just in front of the ear, we suspect a virus. And if the main symptom is that intense, maddening itching with a ropey discharge, you're definitely dealing with an allergy. This structured approach is exactly how doctors decide the very next steps.
For bacterial cases, the methodical approach is highly effective. Step 1. Frequent and gentle eye washes with sterile warm saline. This helps mechanically wash away the deleterious infected material. Next, broad-spectrum antibiotic drops like ciprofloxacin or ofloxacin are instilled every few hours during the day. And finally, a soothing antibiotic ointment is applied right at bedtime. This nighttime ointment is absolutely essential because it prevents that painful morning stickiness of the eyelids we talked about earlier. However, I must sternly warn you about a very common, very dangerous mistake. You should absolutely never, ever use steroid eye drops in these acute bacterial scenarios. I know steroids can reduce redness, making the eye look better temporarily, but they severely compromise the eye's local immunity. Using them can dangerously flare up the bacterial infection, potentially leading to a severe, sight-threatening corneal ulcer. Please leave the steroid drops alone.
Now, what about the violent, hyperacute, purulent conjunctivitis caused by the gonococcus bacteria? For this, the treatment must be aggressively proactive. The eye produces such copious, thick discharge that it can literally roll down the cheeks. This requires hourly saline lavage just to keep the eye clear. Topical drops alone are completely insufficient here. Strong, critical systemic therapy, like ceftriaxone injections, is an absolute necessity to stop the bacteria from invading the cornea and basically saving the patient's vision. Conversely, when we are dealing with viral infections, they usually run their own self-limiting course, much like a common cold. While a doctor might prescribe a mild drop just to prevent secondary bacterial infections, our primary focus shifts entirely to prevention. Because viral conjunctivitis is so highly contagious, meticulous hand hygiene and completely avoiding sharing personal items are truly the only ways to prevent community spread to our family and friends. So, we've thoroughly unraveled the medical mystery of the red eye today. We've seen how bacteria, viruses, and allergens wage war on the sensitive conjunctiva, and how medical science systematically fights back. But seeing how easily these pathogens travel via our own hands, it leaves us with a provocative thought. Considering how often we unconsciously touch our faces every single hour of the day, how protected are your eyes right now? Thank you so much for joining me on this explainer. Stay curious, stay safe, and please remember to wash your hands.